We are live. Hello, humans. Happy Monday. Dr. Sarah here with Performance is Happening. Today we are doing another interview with our speaker series for the Total Worker Health Symposium, which starts this week. I believe tomorrow are the workshops and the conference starts the following day. Today we have David Hurtado. Did I say it right?
Excellent.
I practiced like 10 times. Okay, I'm going to read you his bio, and we are going to have a great discussion today about leadership and wellness and all of the great things. Okay, today we have David Hurtado, Associate Professor at the Oregon Institute of Occupational Health Sciences. He's a social epidemiologist whose research explores how workplace design, leadership, and organizational policies influence employee safety, health, and well-being. His work spans high-risk industries like healthcare and focuses on developing interventions to create healthier, more resilient teams. We'll be talking about his work in the Total Worker Health Spotlight on leadership and exploring how leadership behaviors and organizational culture can shape worker health and performance. Yay. It's very impressive.
Thank you, Sarah. And thank you for having me here.
Of course. So I did a little research on you because one of my big passions is taking the science and actually applying it to how you can take the theory and how it actually works in practice. And I noticed your research looks at how leaders can directly impact worker health and well-being. So what are some of the leadership behaviors that you found make the biggest difference in creating psychologically safe and healthy workplaces?
I think the most fundamental, but that's not necessarily the simplest behavior, is listening and active listening. I think that's a fundamental behavior because based on our own studies, we've shown that when employees feel heard, good outcomes happen. And feeling heard means two things. One, just the basic, feeling that they are listening to you and that you have the you have the enough psychological safety to speak up, and once you speak up, that you feel that what you said was acknowledged and understood. So that's the first piece, and that's very important, especially for things that exceed the level of power or authority that your direct supervisor may have. And in healthcare, which is the industry we study, there are a lot of systemic issues that obviously are beyond the control of the team leader or the clinic supervisor or whatever. But for people to feel that they can mention those, and their team leader could validate them, that's one piece of that's one important side of what listening means. And then the other side is acting upon what you said, and and that combination of acknowledging and changing the things, or acting upon the things that you just said to your leader, are the drivers of good leadership, and that is reflected on people staying and people performing well, and then eventually on well-being and wellness.
Yeah. I think one of the things that you said is feeling psychologically safe to be able to voice your concerns.
Yeah.
I think that's so important. Is there any suggestions you have from the leaders who care about well-being, who want to create that climate of safety where they can start voicing their opinions, perspectives, experiences? Do you have advice for the leaders of how they create cultures like that?
Well, I think our advice will be rooted on the evidence that we are finding in the study, which is creating opportunities to employees to speak up in different ways. So, town halls or staff meetings, larger group gatherings can be intimidating or may not be the most conducive to gather feedback. So we are finding, promising evidence that one-on-one, private, short, brief, confidential um, meetings or encounters between leaders and their team members can foster well-being. And part of the reason from the interviews is that we feel that those meetings feel less intimidating than larger gatherings. If they are offered on a routine, standardized way, they don't feel like the employee need to, um, you know, go and ask for a meeting. So our advice would be to establish those meetings just on the frequency that is reasonable, and could be monthly or quarterly. We did quarterly in our study, where you offer your team members, 30 minutes more or less, just to speak their mind and see if there are some things that they can, you know, feedback or things that they would like them to know, and just make that offer. And people who would take it may very well say to them things that would be important for the team leader to know, either from their personal life that may be explaining some um, performance issues, or some suggestions on how to improve workflows and procedures in the workplace. So our study, which we've been talking about since the last year, now that we have the evidence, it was all about that, about asking team leaders to offer these check-ins, for that, so that people, once they take them, they could bring up some things that would be important for them, whatever those may be, and just give the chance for your team members to speak up, as opposed to ask, and just say, I'm here to listen. This is not a performance review, but if you want to bring information from your personal life that may be explaining behaviors, I'm all ears. And depending on what we discussed, then we'll take actions. And I think that's important when, for instance, you may need an accommodation, or there's an ongoing, family or personal struggle that you don't feel that, um, you don't want to discuss in public, but perhaps you want your supervisor to know. So, going back to your question, I would say that creating those encounters that are more open-ended and frequent and standardized, so they know that that's an option, as opposed to just saying once, well, we have an open door policy. I think an open door policy may be more directed if you translate that policy into, like a calendar hold, say, or inviting people to schedule time with you, like something more like beyond the words, and a little bit more of a structure, without like making it like a firm commitment necessarily, because that may backfire, because it could be very rigid, and these conversations are fluid. So I think the point I'm trying to make is really offering those one-on-ones
Yeah.
to discuss things that are not necessarily work related, but obviously are, or that are not performance related, but they're work life related.
Yeah. No, I love that. It sounds like, one, you're creating that human connection that I think often when you go into an organization, they're looking at numbers and ROI, and we're not robots all yet. We're not all robots yet, and you're humans, but to have more than what you said, like not an open door policy, but a real discussion of how are you, the human, doing, what is going on. And I love that you said, like, it could be outside of work as well, because as humans, we take our brains, our bodies, our issues wherever we go, and whether we're supported in work and in life, like, it's such an important skill to see the human as a whole human, and they have issues that are going on in their family that may affect their work life. And so I love that. That's so great.
Yeah, with the caveat that boundaries should be respected,
Yeah.
right? But I think a good leader from their position of leadership can ask, what can I do from my position to help you and help your performance? And there are, accommodations in terms of flexible work arrangements. Is one instrumental way leaders can help people navigating their own family or personal struggles, or accessing benefits, or just changing the workload, whatever. um, and obviously the supervisor is not expected to solve people's personal life, but ignore them is going to backfire. So from their position of leadership, the challenge is to, okay, how can I use my position to help you give the best performance given your circumstances?
Yeah. I love that. And it's going back again to treating humans like humans.
Yes, and there are many in healthcare. There are many pressures. Um, uh, burnout is very real. Providing care to people and interacting with humans, that can be exhausting. um, Especially when the system sometimes is, it's very hard to schedule appointments. It's navigating benefits is difficult. So there's a lot of frustration that either providers or people in the like support teams at the clinics, are on the receiving end of the patients. um, and they're like the post pandemic is the financials of healthcare systems is really dire right now. um, so there's this pressure in addition to the emotional toll that I was describing. There's this financial and operational pressure to be lean, to be efficient. So that can be against having that connection. So just recalibrating at least once per quarter, per semester, just have a one-on-one where you touch base at a more human level with your team members. It seems that kind of set a little bit of these pressures, that what we learn in our studies, that team leaders may understand team members, sorry, may understand that the team leaders are just like executing like top down directives, but acknowledging that pressure also, and the impact that it's having on daily operations. That conversation can also be good for leaders because they feel that they're not the bad guys, so to speak. So it's also a way to be transparent in how these decisions are made. If team leaders offer this one-on-ones on a frequent basis, then they could also use some of that time to explain how these decisions are also being imposed by to them by higher ups. So it can work both ways. But yeah, the human connection is very critical to create or to maintain in emotional intensive industries like healthcare.
Yeah. And I think a lot of people who are in healthcare, not only do they have their own personal issues, work issues, home issues, but then they have the caregiver fatigue, and they are humans and usually in the field because they care about others, and then develop relationships with patients depending what those patients are going through. Then some people can take on that as another stressor and work thing. So I think having that ability to communicate of, here's what's going on, as a whole human, how do we have support with that? So I think that's
Yeah.
awesome. If you were to suggest something for an organization that wanted to start creating this opportunity for dialogue between leaders and employees, or they know that they need to make some sort of organizational change to have this top down approach, but also incorporating the human, what would that look like? Or where would you start?
Well, there are multiple point of entries. I think the check-ins would be it's that one-on-one 30 minutes on a quarterly basis, just to talk about what's on your mind, like very no agenda, just like open-ended openings on supervisors can open that encounters saying, "What's on your mind?" That very unstructured type of conversation, albeit in a somewhat structured format, which is on a quarterly basis, 30 minutes, private location. That simple act. But there's also a combination of tools. There are huddles where people can discuss operations and topics that are on their minds. Um, there are other strategies to yeah, establish that connection. Yeah, and there's a lot of quality improvement techniques also that can be implemented. Plan, do, study, act cycles for very specific issues, including those affecting the well-being of the workforce. They don't have to be operational. Um, so a combination of tools can be implemented. I think what I what I probably don't think would be enough is just to make these lip service comments of we have an open door policy or your well-being is important. If those things are not reflected in a specific actions and resources dedicated to those, then that's not um, that's not gonna stick. And what we learned from our study is that the implementation of the check-ins is not burdensome. Um, if you have a large team, and by that I mean more than 5 individuals, it's not going to take more than an hour because you're going to schedule them an hour per week. Sorry, because you can schedule them um, just maybe 1 or 2 per week, and over 5 weeks, you already talk with all your team members, and yeah, so obviously our recommendation will be based on the evidence that we're gathering, and we have supporting evidence that they're not perfect, but they are showing um, promising trends that uh, people feel that the supervisors support them better, and people feel that they're on the same page as far as values with their supervisors if they hold these frequent and brief check-ins.
Yeah. I think that's important for the folks that are listening. If you're in a leadership role, to have these discussions, not even what the next step is, but to have that relationship building tool, because yes, you might be in a leadership role, but it's still a human having a conversation with another human. And then next you can brainstorm about what are the next steps or what is going on in that person's life. That's like alarm bells, alarm bells, alarm bells. That's what they need assistance with. And regardless of if the leader has the tool or not, like then at least you know what to address. Because if we don't ask, if we don't have conversations, we don't know. Because people mask at work and they want to perform. And I think what you said earlier of making sure to say, like, this is not a performance review. This is about what you need and what's going on in your life and how you can create that conversation. I think is really important.
Yeah, and sometimes it's not just about work family stuff, which can be tricky because there's these boundaries and there's these external elements. But in a study, we also um, like heard about improvements to processes. So I'll give you an example. Scheduling vaccination clinics is one of the big things in the fall for every primary care clinic. So we've heard stories of improving processes by having these suggestions brought up in these check-ins, because people know what's working based on what they have to do every day, right? So, and a lot of these suggestions can be omitted if there's not you know a venue, an encounter to talk about. And so by having these check-ins, if you open them, like, what's on your mind, and someone says, well, I've been working on this and I have this suggestion, maybe that's an opportunity that could be missed if you don't have these check-ins or these touching base moments with your team members. And in that example of the one worker said, I have to do this, and it would be easier if instead of doing this, I have to do that and schedule on blocks and not blah blah blah. So it had like a whole, suggestion based on that person like work experience. So it was fantastic. So and without this forum, that suggestion may have been lost.
Yeah. And I think, I mean, you know this as a researcher too, but what we think is going to work in theory, what theory says, and actually applied, like you put all this practice into a hospital and they're like, yeah, but with the functioning, it has to go this way. So it's great for us to guess, but I think it's awesome to be able to have that open line of communication where the people actually doing the work can tell you what they really need versus guessing, which often happens. Tell us a little bit about what your session is going to be about and what you're hoping attendees can take as a take home after they've listened to your session.
Yeah, it's going to be very practical session. It's not going to be about the science. I think there are 4 other presentations, all 10 minutes, so very rapid and very on point. And I think I will focus on the most practical elements of these check-ins, on how organizations can start thinking of implementing those check-ins. And obviously I will point them to the direction of the resources that we created to assist with that implementation, should they wish to do that. So it will be a very practical, on point session.
I love that. So if you're listening and you want tools and tips on how to start having these discussions or bring them into your organization, you should definitely make sure you join David. I wrote down when his session was. 12:15 Central Time on the 22nd.
That's right. Yeah,
That's
on
correct.
Thursday. It's a leadership spotlight, total worker health.
Beautiful. Awesome. My session is going to go down on the 23rd at 11:15, and we are Move at Work Challenge, driving employee happiness and health. So if you would like to catch mine, one of the nice things about this session now being completely virtual is you have 30 days. They will all be recorded. So if you can't make something live or if there are overlapping sessions, you have 30 days to watch all of it, which is exciting for my brain because all my favorite topics are happening all at the same time.
Yeah.
Which is how these conferences tend to be, but that's okay. I think that this is one of the silver linings of having it be virtual.
Yeah, indeed.
Yes. Awesome. Well, thank you so much for joining us today and for taking time. I think it's very important to have these discussions and to have this open line of communication and to talk to the humans like they are humans. That's been one of the main themes that's been coming out from a lot of these interviews, and also the perspective that it is just so much bigger than physical safety, mental health, physical health, psychosocial, all of the things that make humans affect us at work, at home, in our life, how we approach everything. So I think you're doing such important work. Thank you so much for being here. Any closing thoughts for the audience?
No, thank you so much, and see you in the conference.
Yeah. See you at the conference. Yay. Bye, everyone.
Goodbye. Thank you.